Good morning, students. Today we will see about the health change process. This is a Dorothea Johnson's behavioral system model. Yes, Dorothea Johnson is talking about the person is an individual. He will be dynamically changing. Each behavioral system he is telling is a patient's. So every patient consists of seven subsystems. What is seven system? Attachment, affiliation. Affiliation means everybody should recognize him, should accept him, and the achievement, something you have to do, and need the basic needs like a dependency, aggressiveness, ingestion, eating, food, sleeping, aggressive. She is talking that these seven subsystems are interrelated with each other. Any one system is affecting and other system will be having influence. She is talking about the individual's health mainly depend upon the stability of the patient's behavioral system. So any system is affected, like he is not getting a correct affiliation, recognition by the others, that will affect his sex, and about the basic digestion, ingestion, elimination, other needs are going to affect it. So she is telling that the health and wellness mainly become the stability of the individual, this one. So she is talking about the effective, efficient management of the behavioral function of the patients, or that like how if it is a illness, that is also you have to effective, efficient behavioral function to overcome the illness. So, what this behavioral system, why this system is affected? She is talking about some of the stressors may affect the systems. What is this one? It will be affected. Everybody will be having stresses, either the external stress from the workplace or the where the individual surroundings, or this one. Internal stress may be his experience, his maturation, his perception, behavior, biological, psychological, all these called the internal stress. How he is going to respond to it? The stress will be tolerated, the system is going to be the stable. If these stresses are, the tolerance level is affected, the stress flexibility line will be affected, it is going to affect the dynamic system of the behavioral changes. So any illnesses also she is talking about, like the internal external environment will be having the influence upon the stability of the patient behavior. So the inability will lead to the illness. So what you have to do? Effective, efficient manages of the person's relationship with the environment. What is the environment? She is talking about the internal, external environment, internal stressors and external stressor. Okay, this is about, she is talking about the dynamic persons or individual have all individual have a seven subsystem, and each subsystems are interrelated with each other, and it is the person's ability to maintain the active dynamic system by the individual family with the group environment and other thing. If he cannot actively involvement, and that's a stress tolerance will be there in this system, this tolerance level is good, this stressor is maintained equally, this is not going to affect it. If it is going to affect, will be affected. So where is our nursing, this one? So what is our nursing action? So the nursing actions will be the nurse protect the stimuli, what is affecting him. According to that, what he has to do, he has to identify that, he has to go teaching, counseling and acceptance and making them, so that his behavioral system will be positive, behavior will be stable there. So you will help him to structure, drive, set a goal and the behavior dynamic equilibrium. So the nurse will be with the help identify which stressor. The stressor going to be unique to one individual to another. It's not going to be the same. So you have to identify them and counsel them, giving the guidance and other thing. According to that, you will drive them, motivate them and maintain the behavioral system equilibrium. So this is what this one she is telling. So you see about the Dorothea Johnson, she only done this theory. She born in 21 August 1919. So she did her 1942 she did her BSc nursing, and 42 began to creation of her theory, and 1950 she has developed the behavioral system model. She also derived from the other theories and applied into the nursing. She always insisting upon the effective, efficient behavioral function of the individual patient to the prevent of the illness. Understand? Like as I told you, in the meta paradigm, person is an open interactor system. It's identify the actions and he is identified as because of his action. He is identified who is he, and the behaviors are controlled by the biological and psychological other social factor, be previous experience, all will be controlled. So any individual person will be composed of the 7 subsystems. These 7 subsystems are interrelated with each other. This have a great influence upon the behavior, and it is also unique to the each individual. Environment, she is only talking about the internal and the external environment. Health is mainly by the stability of the person's behavioral system, and inability or illness can be inferred with the malfunctions of the behavioral system. And effective efficient management of the person's relationship with the environment will be helpful to prevent the illness and protect the individual. So what is the nursing action? As I told you, nursing views as a patient as a behavioral system. So you have to regulate the force and integrate the patient's behavior. So our nursing, this one like indicated that when the system behavior is unstable, you have to find out why it is unstable, and uses the various strategy to maintain the behavioral system, maybe setting the goals, limiting the behavior, teaching, education, guidance, support you will be giving, and the strong background of the stock background you will be giving by the physical and psychological and social support will be helpful the patient to maintain his dynamic behavior. So this is about the health process of the Dorothea Johnson's behavioral system model. Understand? So this is also a system theory. Like mainly she is focusing about the individual behavior, not like a petty human. Thank you.